Good evening, Sora. My name is Frank, and today I will be demonstrating manual muscle test on 3 muscles: the supraspinatus, the supinator, and the medial rotators of the hip.
Yeah.
Can you introduce yourself a little bit, Sora?
Yeah, sure. My name is Sora, and I'm a registered nurse in the hospital. And currently, I work in a renal ward, and I do have a lot of long-term patients, and got a really heavy workload. So we got 3 or 4, 5, even 5 patients for one shift, and we do have a lot of ADLs to do. And sometimes I feel my shoulder, after I finish work, I feel my shoulder, it's really sore, and my hips sore as well. So I really need your suggestion.
Okay, so Sora is a full-time nurse working in the hospital, and your job is busy caring patients and includes a lot of physical movements with both upper body and lower body.
Mm-hmm.
So you also have occasional shoulder fatigue and hip tightness. Yeah. Okay, today's session will help us assess the strength and activation for your muscles through the manual muscle test. And the purpose of the session are to evaluate specific muscles across 3 joints to feel resistance and grade muscle strength, and learn how to identify common mistakes and compensations.
Mm-hmm.
Okay, Sora, in terms of any potential safety concerns, please let me know when you feel discomfort during the test. And we are working within your normal joint ranges. Okay? Do I have your consent to proceed with these tests?
Yeah, sure.
Okay, now before starting the formal testing, let's do a warm-up to increase your blood flow, mobilize the joints, and reduce the risk of the strain. Okay, the first one we're gonna do is for your shoulder circle. Okay, let's do the forward and backwards like this for 5 times each. 1, 2, 3, 4, 5. Another way around. 1, 2, 3, 4, 5. And the second muscle I'm going to test is in your shoulder or elbow joint. So the warm-up for your elbow joint is elbow flexion and extension like this. You can do in this way 5 times each. Okay. Oh, sorry, it's flexion and extension. Yeah. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Now for your hip joint, the warm up for it is the hip seated rotation. Yeah, you can sit there and open your thighs. Then, I'll demonstrate like this way. You can rotate internally and laterally. Yes. 5 repetitions for each side. So you can do at the same time. Yes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Okay, I will demonstrate the correct tester and subject positioning before we begin, so you know how exactly the test will look and feel. Okay, shall we start the muscle test now?
Yeah, sure.
Okay, the first muscle I will test on you is the supraspinatus. Okay, just a sec. Let me wear my gloves. And to test your supraspinatus, can you sit and put your back?
My back?
Yeah, show your back to me.
This way?
No, the other way. A little bit. Yes, all the way around. Okay. Yeah, I will introduce your shoulder joint briefly. The first muscle I'm going to test is your supraspinatus, which is located in your shoulder joint. And the most important bone in your shoulder joint is the scapula. It's this one. And there are two scapulae in our body, the left one and the right one. And the scapula is also called shoulder blade. And it is a flat triangular bone that sits on the posterior thoracic wall and plays a vital role in shoulder function. And there's a spine, I can feel, there's a spine on the scapula, and this is called the spine of the scapula, and it's easily palpable. It is a prominent ridge on the posterior of the scapula, this way, and it ends in the acromion, here, and which separates the scapula into supraspinatus and infraspinatus. Today I will test the supraspinatus for you. Okay. And the supraspinatus sits in the supraspinatus fossa above the spine of the scapula. The origin of it is supraspinatus fossa, and the insertion of it is the suprafacet of the greater tubercle of your humerus. This here. And the function of this muscle are essential. It is important for your shoulder abduction, like this. Your shoulder abduction, yes. And which initiates first 15 degrees of abduction before the deltoid takes over, before this muscle takes over your shoulder abduction, okay? And it stabilizes the glenohumeral joint by holding the humeral head. This is the humeral head, firmly against the glenoid cavity to prevent upward migration during deltoid action. And it assists in humeral head centering during dynamic movement by playing a key role in rotator cuff function. Okay, the test for your supraspinatus is called MMT test. Okay, now I will this is the way you exactly sit, and I'm going to put on my left hand onto your supraspinatus. And can you abduct your arm to 90 degrees and your forearm rotate a little bit internally, and with your finger, with your finger pointing inward. So it feels like some empty a can, right? Feels like empty a can, yes. And my right hand will grab your wrist, and when I put some pressure onto your wrist, can you just resist it? Then I can feel if your supraspinatus is contracting, okay? Are you ready for it? Okay. I don't think this is correct, because now your deltoid is taking over. Your supraspinatus is not working at the moment. That's not right, okay? We're gonna try again. Okay. Oh yes. Now this is good. This is the correct way. Okay. I will have a table for it. Then I will grade number 5, which means your muscle is healthy, okay, and strong. Okay. Now I will. It is very common to see some mistakes like what I just introduced to you in the test. The first one could be the overuse of the deltoid. The deltoid takes over shoulder abduction. You may see shrugging rather than smooth abduction. The secondly, the upper trapezius, like this big muscle, patient will elevate the scapula instead of abducting the arm. And the third one could be leaning trunk laterally. Patient leans to torso to the opposite side and to give the permission of abduction. And lastly, it could be external rotation substitution. Rotating the arm outward can allow the long head of the biceps and the deltoid to assist. Okay. Okay, now Sora. The second muscle I'm going to test is the supinator, which is in your elbow joint, yes, in this area. And the elbow joint is a synovial hinge joint, that allows your arm flexion and extension, or extension and flexion. The joint consists of 3 bones. Okay, I will bring you through about this. The humerus, yeah, this is the biggest bone of your arm, and the ulna is the ulna is this one, the medial one, and this bone is called radius. Yes, and there are 3 articulations with 1 capsule. They are humeral radial, this one, the joint, and the humeral ulnar joint. Humeral ulnar joint is here. Yeah, and the proximal radial ulnar joint, which is the joint between these 2 bones. It's in the middle of here. Yeah. Okay, and the supinator is the deep muscle in the posterior compartment of your forearm. Like in the first third of it should be in this area, wrapping around the proximal third of the radius. And the origin of this lateral, the origin of this is the lateral epicondyle of the humerus. It's in here, yes. And the radial collateral of the radius, and the annular ligament of the radius, the supinator crest of the ulna, yeah. And then the insertion of this is proximal radius, yeah, okay. And the function for this muscle is the supination, yeah, which rotates your radius laterally, yeah, laterally. So the palm can fist up.
Yeah.
Yeah, that's called pronation. Yeah, supination. Yeah. Basically, holding something, it feels like you can hold something in your hand, like holding a ball, holding a soup ball. Yes. It works best during low unresisted supination, especially with the elbow extended. Okay. Now, shall we start the test?
Sure.
Okay. You can extend your arm in this way. Yeah, in this way. You come into the central, and your palm is facing down. Okay. Now I will put my left hand above the elbow and the other hand above your wrist. Can you now use your rotate your humerus laterally, which means in this way? Okay. Yeah. Are you ready for it?
Yeah.
Okay. Yeah. Yeah. Can you try again? Yeah, that's great. Okay. Thank you so much. Okay, I can feel the strength of your supinator, and I will grade it 5 as healthy and strong muscle.
Great.
Okay. It is also common to see some mistakes and compensations in the test. The first one could be overuse of the bicep brachii. This is your bicep. Like sometimes when you flexes the elbow while supinating, relying on the biceps instead of here. Okay. Shoulder external rotation compensation. Instead of true forearm supination, the patient rotates the whole shoulder outward to conduct movement like this. Ideally, what I want is this, but some patients, they just compensate the whole shoulder. Okay. Yeah, like this. Okay. The forearm pronator tension. For example, sometimes when you finish playing badminton or playing tennis, and this sort of muscle is very tense and it's very tight, so you cannot achieve the full supination and may lean the trunk to adjust the elbow instead. Okay. Yeah, that's the second one. And the last one I want to test is the muscle of the medial rotator of your hip.
Yeah.
Okay. Because we don't have a table in house, so we're gonna use a chair instead. Then, Sora, you're gonna sit on this chair.
Yeah.
Okay. Then, can you sit like this way and hold your hands on the side to stabilize your up trunk? Okay. Yes. Now for this one, for the medial rotator of the hip, it's in the hip joint, and the hip joint is a synovial ball and socket joint, which is very stable due to deep socket, strong ligaments, and the surrounding muscles. The hip joint consists of pelvic bones. It is called a socket, composed of ilium, ischium, and pubis. These bones fuse during the development when you are getting older, yes, but not too old, I mean in the adolescence. Okay. To form the acetabulum, yeah, which is the biggest and strongest bone in the is the femur, and the head of the femur is also called the ball. So this is the ball and socket joint, which articulates with the acetabulum. There are so many muscle groups attached to the hip joint, responsible for your flexion, extension, adduction, medial rotation, and the lateral rotation. The medial rotator is the target muscle to be tested today. And unlike your lateral rotators, like here, the lateral rotators, there isn't a single large isolated medial rotator. Instead, several muscles contribute. And the primary medial rotators include the gluteus medius, gluteus minimus, and the TFL. And the secondary medial rotators, especially with a hip flexion, include abductor longus, abductor brevis, adductor magnus, and pectineus. Oh, these are just some terms, you don't really have to understand this, which are on medial side of the hip. And the function of that muscle obviously is for your hip rotation laterally and internally. Okay. And it is important for activities like walking, running, pivoting, and changing directions. Now I'm going to test that muscle.
Yeah.
And during that test, I will hold my put my right hand in onto your inner thigh. Okay, this side, and I will hold your ankle with my left hand. Then I will push your leg inward. Yeah. So when I put some pressure on it, can you resist it?
Yeah.
Okay. Are you ready for it?
Yeah.
Okay. Yeah. Yes. We're gonna try again.
Yeah.
Yeah. Yeah, that's very good because I can feel clearly of the inside thigh, and this medial rotator muscle contracts.
Yeah.
Got the strength. So I will also grade it number 5 as a healthy status of your muscle. Okay. And it is also common to see some mistakes and compensations in the test. First one, patient could move the whole leg inward instead of true femoral rotation as a substitution for the hip adduction. And the patient flexes the hip instead of keeping neutral, which recruits TFL more than gluteal fibers, causing excessive use of hip flexion. Patient rotates the ankle or foot outward instead of moving the femur and the hip. Okay, these are all the tests for the 3 muscles. And after performing the muscle test, I will have to note down the results on a grade table. A strong resistance, grade 5, means healthy muscle activation. A weaker response, grade 3 to 4, which sort of doesn't have it, could suggest a muscle imbalance, fatigue, or injury. Bilateral differences could be possibly point to asymmetry or previous injury, and other factors such as fatigue, poor posture, or technique errors can all affect the results. For example, if the supraspinatus feels weak while the deltoid compensates, we might consider early signs of rotator cuff dysfunction. If the hip medial rotators are weak, it can lead to poor pelvic stability and in gait and running. Okay. To summarize, today we explored the manual muscle test for 3 key muscles. The first one is supraspinatus. It is vital for initiating shoulder abduction and shoulder stability. The second one is supinator, responsible for smooth forearm supination, like this, especially In functional tasks like holding objects, the last muscle I tested is the medial rotators of the hip. It is essential for pelvic stability during gait and directional changes. The purpose of the manual muscle test is not only to evaluate muscle strength, but also to highlight common compensations, such as trunk leaning, scapular elevation, or overuse of synergist muscles. And identifying these compensations is critical for accurate assessment and for planning effective rehabilitation. Thank you, Sora, so much for participating in this demonstration. Your feedback is really valuable for me and helps ensure that I'm applying the correct positioning, resistance, and explanations. Thank you so much.
Thank you for your assessment.